Okay. So yeah, we had talked about a bit about um, different types of data. How do you collect that data? What is a literature review? Because you've been asked to do a literature review as well in your project. So a bit about that we had discussed. We discussed about the steps of a literature review, and then we had talked about what is a sample data, why do we take a sample data, why don't we take the whole data. Okay. And then we had discussed the types, how are the different types that we collect our data. So there was probability sampling and there was non-probability sampling. Okay. So these have their differences, they have their pros and cons. And we had discussed this sampling method as well. Yeah, I hope you all remember them, and what are the benefits and the disadvantages of each of these. Like Ideally we would want to do a probability sampling. However, because we don't have enough uh, we don't have the resources, enough resources, we would never have enough resources. By resources I don't only mean money, I mean time, mean manpower. So that in this project, it's slightly unlikely that you'll be able to do anything beyond non-probability sampling. Having said that, it's not a sampling method that is not used. It is used, and it is and when you don't have a probability sampling, you have to use a non-probability sampling. So um, we had talked about data analysis. Why is it important? What are the different ways we can analyze our data? We talked about qualitative and quantitative. A bit about reliability versus validity. So these are two concepts that talk about the quality of your research, and they tell you how well your what method have you used, and how strong is that method. So your research methods have to be very strong. Okay. um, and that is when you're testing something. Okay. When you're using a test, for instance, you're using pap smear to catch cervical cancers or cervical cancers. You're using mammography to catch breast cancers. How valid are they, and those tests, and how reliable are those tests. Okay. Reliability is about the consistency, sorry, so how consistent is a measure. Okay. uh, so if you've tested someone with with, let's say, breast cancer using a mammography, how reliable, how what is the possibility that every time someone comes, you will have the same measurement in them? So they will have, so whoever has breast cancer, they will be caught through this, or they will be diagnosed through this measure. How consistent is it throughout the patients that you use? And validity is about the accuracy. How accurate is the measure? So reliability is that if I'm testing the same test, and I've done it in one person, I've tested it, and the technique that I've used, is it reliable? Is that measurement reliable as well? So consistency means that it needs to be consistent. So every other case that is there of breast cancer should be detected. And valid is how valid. So if there's positive result, how accurate is that result? Okay, does everyone understand what I'm saying? So I'll give more explanation. It's very important to consider reliability and validity when you have your throughout your research. Like, it starts from the research design, planning your methods, and writing up your results, especially in quantitative research methods. Reliability versus validity, what's the difference? So what does reliability tell you? the, it tells you that to the extent to which the results can be reproduced when the research is repeated under the same conditions. That means every time I'll use this research, or I'll use this method to detect disease, it will give me the same result. However, validity is the extent to which the results really measure what they are supposed to measure. So, if I'm testing someone and they're positive, they're actually positive. They're not. It's not a false positive. Okay, so it doesn't mean that it should not happen that that person does not have the disease and they have been tested positive, or on the contrary, they should have the disease. If they have been tested positive, it should not give a negative test result. So how is reliability assessed? By checking the consistency of results across time. So every time, so you'll check more number of patients and across different observations. So there might be different people who might be using the test. You might be using a different setup, but you'll have the same results. So positive will always be positive. Okay. By checking, so validity, how do you measure validity? It's by checking how well the results correspond to established theories and other measures of the same concept. Again, positive should be positive, negative should be negative. It should be accurate. How do they relate? Okay, so a reliable measure is not always valid. The results may be reproducible. So if you have a result that a measurement that is reliable, it might give you false positive or it might give you false negative. Okay, the results may happen, you might have the same results over and over again, but they're not correct. However, a valid measurement is generally reliable. Okay, so if there's a valid result, if it's true, what it's showing, it's true, it should be reliable as well. What is reliability? Reliability refers to how consistently a method measures something. If the same result can be consistently achieved by using the same methods under the same circumstances, the measurement should be considered reliable. So, for instance, you measure the temperature of a liquid sample several times under identical conditions. The thermometer displays the same temperature every time, so the results are reliable. Again, a doctor uses a symptom questionnaire to diagnose a patient with a long-term medical condition such as diabetes. Several different doctors use the same questionnaire with the same patient but give different diagnoses. This shows that the questionnaire is not reliable. Okay, so that means that the questionnaire, if it's repeated in different people, in different conditions, different other people use it, it doesn't give the same results. So that is reliability. What is validity? It shows how accurately a method measures what it is intended to measure. If there's a research that has high validity, that means it produces results that correspond to real properties, characteristics, and variations in physical or social world. When you have high reliability, it is an indicator that the measurement may be valid also. If a method is not reliable, it's probably not valid as well. So a thermometer, again, the same example of a thermometer. Sorry, I might not be want to go through all of this because this is not important. I should be able to do this only because it's too deep. The rest you can have a read of it, but it's not required from you. So an example of validity is like, again, the thermometer. It shows different temperatures each time. Although you have controlled conditions and to ensure the sample's temperature stays the same, the thermometer is probably not functioning properly, and therefore its measurements are not valid. Again, if a symptom questionnaire results in a reliable diagnosis when answered at different times and with different doctors, this indicates that it has high validity as a measurement of medical condition. I'm not going into details of this. I'll just talk a bit about reliability and validity in your project, like in your literature review. So a literature review discusses what other researchers have done to devise and improve methods that are reliable and valid. Methodology is how do you plan your research to ensure reliability and validity of the measures used. This indicates the chosen sample set, and the sample size, sample preparation, external conditions, and measurement techniques. Results. Coming to the results, if you calculate reliability and validity, state these values alongside your main results. Discussion. This is the moment when you talk about how reliable and valid your results actually are. Were they consistent and did they reflect true values? If not, why not? And the conclusion, if reliability and validity were a big problem for your findings, it might be useful to mention this here. Okay, that's a bit about, these are some of the references that you would want to look at. Okay, um, again, that's the end. I just have a very good figure to show to you. I'll stop sharing this. Has everyone understood this topic of validity and reliability? Just a minute. So validity and reliability, they can be seen in this figure. So I'll just open this up and show it to you. Okay. Okay. So I want you all to have a look at this figure and tell me what do you think. So these are darts. Okay. So this is a game that shows you the concept of validity and reliability. So anyone, the first one, what do you think? Is this valid? Is this reliable? So these are different people have, or there's every time you hit the dart, it hits on this spread area. So your objective is to get here, okay? However, the second time you or others, they're aiming and they aim this way. So what's the difference between this, and this? Can anyone contribute or explain this? It's a very good figure to understand validity and reliability, and then we'll start our assignment discussion after this. Anyone? Is everyone there?
Yes, I'm here.
Yeah. So what do you understand through this? I just need a bit of more interaction so I know I'm teaching and everyone is there.
I think the third picture is the correct one in the sense that the target goal
Mm-hmm.
is to hit the middle.
Yep.
So since the target goal is to hit the middle, and the third
Mm-hmm.
one you can see all the arrow is pointed to the middle,
Mm-hmm.
it therefore means that it is reliable.
Mm-hmm. Very good.
I don't know if I'm correct here.
Yeah. Yeah, you are very close. Uh, yeah, anyone else? Thank you for that. Anyone else wants to contribute? So this figure actually shows the first one. Okay, so the first one shows that every time you hit, you aim. So your aim should be here, okay, the center, which shows you how true or how accurate. So every time you hit here, it's accuracy. Okay, this is what you want to have, accurate results. So this is not reliable. So every time you hit it, it hits on a different point. It's not reliable. Okay, so consistency should be there. So that means it's not reliable. It's not valid at all because it's not at the center. Next, this figure, you see the second one. So you're hitting, and every time you hit, it comes to one certain point, but it's still far away. So these are reliable. So every time you do it, it's consistently showing you the same results. However, it's not true. This last one is the true picture. Okay, so it shows you a valid picture and a reliable one. Okay, so you have both validity and reliability over here. So if I just scroll down here, so here, see, so this is neither reliable nor valid. It doesn't have the true picture, the valid results. Okay, so it always shows you results that may not be positive, or may so the patient, you've tested a patient who's come positive for, let's say, HIV, but they're actually not positive. Okay, so that means that's not a valid test, and this is scattered about. So every time you try and test it, or the other person tests it, it gives you different results, but never does it give you a valid result. This has the same results, but there's a major problem with the validity. This is valid, and both valid and reliable as well. Okay, that's just a figure to share with you and show you the difference. We'll now delve into our assignment discussion, if that's okay. Um, so if we have the time, I will quickly go through um, the initial bits as well, which we had covered. So I'll start sharing my screen. Okay. So, okay. So this is what we had discussed. We were planning. So the research. This unit is the research in health and social care, level 3. Uh, so what is expected from you? So this is the assignment. So you must propose and carry out a short research project, and that's related to health and social care, and explain how this research informs practice. You may choose an opportunity or a problem at a health and social care setting that you know of, or a current issue in health and social care. Does anyone have any idea what you want to do? Anyone?
You pick a topic that relates to health and social care uh, to to perform your projects. I think that's what I understand.
Mm-hmm. Yeah. So you're
So
working in
any
health.
topic that relates to health and social care.
Sorry.
Oh, sorry. Can you hear me?
Yeah, yeah.
Yeah. I mean, you have to choose a topic that relates to health and social care.
Yes.
Yes.
Yeah, so you have to mention how it helps, how would it help you in your setup where you're working. Okay, so I'll go through it. But you should have an idea, like people are interested in respiratory health, some people are interested in studying COVID-19, etc. So you want to choose an opportunity at a health and social care setup which is familiar to you. Okay. Um, so instead of doing something that is you're in the health sector and you want to do something on the environment, that doesn't really make sense. Okay, so consult with your tutor or supervisor to determine a suitable area for your research. And what are the study skills that we want to assess you in this? It's critical thinking. So we want to see how critically you think about your research. Planning, organizing, and time management. Okay, because you have less time, it's just 2 weeks. Research. Okay, your research skills which you have gained through this module. Gathering of information, note taking, and summarizing. Sorry. Your analysis, your oral and written skills, your academic skills, including your references, which should be Harvard referencing, um, and application of IT skills. And how well do you reflect on that research? So the first task for this project would be, so This is to identify and agree on a topic for research and produce a research project proposal. So I've shared the template of a proposal with you. I'll do it again. Your proposal should show some bits here. So you should show that you have agreed the research topic with the with your tutor, you have agreed on the research project or the research topic. You cannot start without having your tutor to be agreeing on the research topic. Explain the importance of the aims and objectives of the research. Explain the ethical considerations that apply to the area of the research project. Explain the links between the research and evidence-based practice. Analyze the contribution of research and evidence-based practice on decision-making. And explain the contribution of research to health and social care provision. All of this can be completed through your through the template that I will just share with you again. So you would want to probably gain a merit, or you would want a distinction. So in order to gain a merit, you must want to analyze potential uses for the research findings within within the practice. And to gain a distinction, in addition to this first point, you would want to analyze your own current skills. So just a minute. Yeah. So here you would want to analyze your own current skills and knowledge in being able to conduct a literature review in a health and social care setup towards evidence-based practice. Okay. So the second task is to carry out a literature review. So the first task will be to, obviously, you've done the agreement. Okay. The research project proposal has been completed. That's your first task. After that, you carry out a literature review that is related to your area, which you have chosen, of research, and produce a report summarizing and commenting on the literature reviewed and drawing out main themes and issues identified. Again, in order to gain a distinction, you would want to examine the value of the literature review process in influencing positive change in health and social care practice. I hope that point 2 is clear. Task 3 is to carry out research for your own chosen area, collecting suitable data and recording your findings. You would want to create a sample of data from the findings and apply suitable data analysis methods for the data collected. Again, to gain a merit, you should be able to analyze the importance of validity and reliability of data used within your research. Task 4 is to produce a set of slides. So the fourth task is to produce a set of slides and notes. So I'll just show you how to write down notes at the end of your presentation on the findings of your literature review and the research that you have done. And this PowerPoint presentation should show the data and information from findings to produce results. And you need to show conclusions and recommendations from the research findings. So this is, just have a look at how I'm writing down these notes. So sometimes probably I don't have enough space over here. I don't want to keep my slide busy. So I just write down over here at the end. Okay. So this is how you go about with writing down, writing notes, extra notes for your research. So I hope this is clear. I'll share a few more bits with you just now. So this is, again, just, I'm just making you familiar with this document. Just have a look at this document. It's, again, regarding your unit, which you're studying. And it's either pass, merit, or distinction. You would want to demonstrate achievement of learning outcomes, which we have discussed so far. So we have spoken about understanding the role of research and different approaches in health and social care practice. We have worked on how to identify and justify a topic of research within services of health and social care. I'll just share the links with you. Be able to complete a research project and in health and social care. Um, so what we would want you to do is ideally go for secondary research. Okay, so secondary data will be used here where what does secondary data mean? It means that it's data, it's research that has already been done, and it's those research findings will be mentioned by you. Okay, I'll just share the research proposal template with you, and I'll share some links with you as well. Any point that you need clarification on, please let me know. Okay, uh, so obviously because you don't have time for and the resources for data collection, but if you are interested in data collection, we don't stop you from doing it. Okay, so this is your research proposal template. Here comes your name. So you'll have this proposal template. You should use this template. Okay. It should be available on Word. If you don't have Word, you can also use WPS, okay, which I am using currently. Sometimes you don't have Word, so you can use this as well. So what is your role within the organization, and how are you linked to your proposed topic of research? State the aims and objectives of your research. So your aims and objectives will be different. We have discussed in detail about the difference between aims and objectives. Just have a look at those PowerPoint presentations, the recordings of them. The purpose of your research. So here you should give a background or an abstract, or it's also called an introduction at times, which should be 30 to 50 words long. What is the specific focus of this research? So probably you want to see social determinants of health and their effects on the health of an individual. So just a statement that you can give here. The key point or issue of interest in your research, the broader significance of this point or issue of interest. So you can write more about it. Outline what point your project will aim to establish and briefly explain how this will impact upon your practice. Okay. So wherever you are working or you plan to work, how will this topic impact on your organization? So what benefits do you expect to happen based on your research project? And then you have a literature review to do, 30 to 50 word long, which is overview of the published work that is already there based on your topic of research. Research methodology. So is it primary or secondary? So you use secondary data. For instance, if you use a project that has been already published, you would want to use their methods, okay, but in your own words. Recommendations would be to consider conducting research through secondary methods, as I just said. These are some sources of information. So you can use these books, articles, or journals. You have loads of resources over here. Your results or conclusions will be mentioned over here, and these will be the results and conclusions of the study itself, of the project itself, if you're doing secondary data analysis. And then ethical considerations are all of these which you have to mention in your research project, in your proposal. So this is your first task, okay? Once this has been completed and it's been approved, so you need to write a research project, and it should be 3,000 by 500 word long. Okay, so in this you will write the introduction, which will be longer, not just small as this template. A literature review of 1,050 word long. Research methods should be 450 words. Data analysis and presentation should be 750 words. Conclusion and recommendations should be 500 words. So anything 10% above and beyond this is acceptable. Okay, so only 10% we would agree. Please make sure you refrain from plagiarism. So the university does not accept anyone copying and pasting their work. So whatever has to be done. So if you've if you've copied and pasted somewhere, I'm just taking your attendance if that's okay. So if you've copied and pasted somewhere, please make sure you have written it in your own words and you have referenced it properly. Okay, without references, there's no point just copying and pasting. That can be done by anyone. So you're professionals and you need to work with integrity. And that is why we trust you, and we have a special software that almost every university has. And anything that's flagged up, you will be informed about that. And yeah, you might have to actually redo your work. So that's not very healthy, not very helpful. Um, I'll just share a link with you that you can use for your research projects. If you want to look at it, just have a look at it. I'm sharing this in the group chat. Sorry, in the chat over here. Just copy and paste this link so that if it's there with you, uh, you can have a look at it even when I go offline. So um, I've ended the class, but you need to have this with you, right? Um, because once this meeting ends, you won't be able to access the chat, unfortunately. So here, um this is one link, and then I'll share another link as well. Is everyone able to access this? Please try and have a go at this. Try and open this link and have a look at. Um, I'll just show it to you how it works in just a minute. Okay. Yes, it's working. Okay, that's brilliant. Thank you for informing me. Okay. So I'll share my screen with you. So research projects here. Anything that you could have a look at other links as well. So there are a lot of links that have been shared with you. That's even on Moodle. So have a look at them as well. So they will give you an understanding also of what research projects would you want to use, would you want to work on. So for instance, I want to work on the different areas that are here. So if I want to work on science, let's say, and I apply these filters. So there are different methods of different topics that you can see here. You can have a look at false positive results, for instance. If I want to see, let's say, this project, building communities to share and use knowledge, tools, and insights for better care. I've just opened this up. So this is a project that has been published, and they've given you links to the project itself. And if you want to have a better view of this project, you can always copy and paste this and Google it up. So if I have this here and I want to see this project in detail, I'll just copy and paste this over here. So I've opened it here. So this project has so you need to know where these projects are coming from. Okay, so you need to make sure that whichever project you're seeing, or can't see your shared screen. Okay, I'm just sharing it now. I stopped sharing it. I was scrolling through other stuff. So this is the project that I was mentioning. So I had a look at that project and I copied and pasted it. So this is what I've come with, the results of the project. Okay. So you have this whole project over here and you can have a look at um, the aims, the objectives of the project, and different other bits. So the methods will be here. Uh, this ambition will be the aim. The purposes of the project will be here. I'm just giving you an example of a small project over here. Okay. Um, and the different methods that they have mentioned over here. And if you go down, if you scroll down, I hope my screen is visible to you all. Yeah. So there's a lot of information that are here, that is here. So this is the reason for making you do this is to help you understand how research is done. Okay. So if you've read this properly and any projects like these, it gives you a good understanding of how projects are done and what are the concerns, ethical concerns that you may have with projects. Okay, so this is one link that you can access. Please uh, save this link at your end, copy and paste it. Just give me a minute. So there's this link that you would want to access as well. Does anyone have any question? I will look at other links as well, and I'll share with you whichever are appropriate. I might do that today or I might do it tomorrow, because I may discuss with the team tomorrow and share some more projects with you. So um, there's this
Sorry,
link.
can you give me the first link again, please? I didn't get the first link.
The first link, okay? Yeah, no problem.
Yes.
Yeah, I've just shared it again.
Thank you.
No, that's okay. I'll share my screen again. So there's this medical research projects that you can have a look at. So it tells you how do you want, if you want to choose a research topic, how do you do that? It gives you a little understanding of um, different projects that you could think about. So sometimes you don't actually understand what project is you would want to work on. So there's this whole list of projects that you can think of. So there's all of these projects you can have a look at and think of what you might be interested in. These are just topics of projects. They're not projects actually. They're just to give you an overview of what projects could you think of.
Good morning, President. This is Coach. President, just send a message.
Okay. Is that clear? So as you know, yeah, we've completed our assignment discussion. So your first step will be to write down a research project. Just scroll through research projects, whichever interests you, and complete the template that has been shared with you. So once you've done that, and you've shared it at learnerwork at ukversity.co.uk, once that has been done, you will then want to work on your so once you have an agreement that okay, this is this is okay that you want to do, uh, the next step will be to do your further studies, further research, which I've discussed. You will get all the PowerPoint presentations, the links to them on Moodle by Monday. Any questions? So if you have questions or you have queries, please make sure to direct them to learnerwork at ukversity.co.uk. We are happy to help you as much as we can, but we need to know that what your understanding is and if you're struggling. Okay.
Please, I have a question.
Yeah.
Okay, so the last your last sentence, I seem not to understand. Does it mean that they are already selected project topics? It's just for us to pick from it and get approved.
Yes, yes.
Oh,
So there's,
okay.
but yeah, but you'll have to fill in the template that has been shared with you, and that template will obviously be from the other project. That the information will come from the project that you're studying, or the project that you want to write in depth about. Um, so we understand that, but you have to write the references. The references should be there, that this is how I got the project and this is the reference to that project. And it's not your original work. It is work through someone else. And we agree with that. And that is why we have said to you that you're allowed to work on it. However, you need to reference it.
Okay. So
Yeah.
please, could you please share this section at the end, because I'm at work and I didn't quite follow everything.
Sorry, I didn't get you.
I'm asking if you could please share this section probably on the WhatsApp page, so that I can go through it, because I'm at work, so I wasn't really concentrating.
The template, the the template.
Yes, yes,
Okay.
and this section as well.
Yeah, this whole the links will be shared with you by the team on Moodle.
Okay,
So yeah. So this should also be there. So this template should also be there. You should ideally use this template for getting your research project
okay,
approved.
okay.
Yeah.
Thank you.
No, that's okay. Just have a look at the video and then you'll understand. If you don't understand any bit, just shout out. Yeah. Just let us
Yes,
know.
thank you so
Mhm.
much.
That's okay. I wish you all the best and I hope to see you soon again. Again, any questions? Please let us know. Okay. Okay, so if there are no more questions, I shall end this meeting. Take care, everyone. Have a nice sunny day. Yeah. Take care. Bye. Bye. Take care.